If we can have a different kind of arms race, instead of an arms race of guns, an arms race of how quickly can we get vaccine into people's arms, the world will be a safer and a healthier place. What we have is an unacceptable situation. It is both ethically wrong, and it's also dangerous epidemiologically, because uncontrolled spread of COVID anywhere is a risk everywhere because of the emergence of dangerous variant viruses that might be able to escape vaccination. That is why it is imperative that the world works together to scale up access to effective and safe vaccines everywhere in the world. In terms of the vaccination, getting the vaccine reviewed and approved by international regulators is an essential step, because that gives everyone comfort in the quality of the vaccine, the safety and the efficacy of the vaccine. But more broadly than vaccination, I think there are lots of opportunities for collaboration in strengthening laboratory systems, human resource training, primary care, vaccination programs, not just the vaccine, but the people to deliver it in countries all over the world. It's in all of our best interest to make sure that countries throughout Africa and Asia are much better prepared than they are today. If we do that, we'll all be safer, we'll be healthier, and our risk will be lower. The COVID pandemic has been an unprecedented challenge for every country in the world. And I think every country has to look back and say what went well and what could have gone better. Clearly, for example, in the United States, much of what we did was very problematic. In China, starting in late January, we saw really extraordinary efforts, very successfully, to control COVID. This is a tremendously successful enterprise that is very impressive. And I've been saying since February of last year, contains very important lessons for countries around the world. The issue of the origin of COVID is more controversial. And I think all we can say is there should be an open investigation, there should be clear conclusions, and whatever the findings of those conclusions, there are some things that we know need to be better all around the world, including in the United States and China and every other country. China has many strengths, and we are very honored as Resolve to Save Lives, an initiative housed at Vital Strategies, to be registered in China, in Shandong province, and to work in collaboration with the government to promote heart health through better treatment of high blood pressure, reduction of sodium, and other measures to help people live longer, healthier lives. China has so many strengths. At home, all countries, including China, will need to look at their public health systems and their primary healthcare systems, and to think of how they can be stronger. Because if we look around the world, there really are only a few countries that have very strong public health and primary care systems. Thailand is one, Cuba is another, Costa Rica is another. These are much smaller countries than China, and so the challenges are different, but we should all learn from one another and figure out what works well in different places and what we can do more of. China has been very generous with its work in various countries to build facilities, to support development. And one of the things that I hope will happen in the coming months and years is a true global collaboration to do more together.